Hi, Bhavna. Hi, Bhavna.
Hi,
Can you?
Sashikala. How are you?
Hi, how are you?
Hello.
Yes. Yesterday you attended the class?
Hello.
Hello.
Just
Yes. Hello, can you hear me now?
yeah, just a minute. Just
Yeah, sure.
yes. Hi.
Hi. Hey, yesterday you attend the class?
No, actually, I was absent yesterday
Okay,
class.
okay.
Uh, uh, actually, I
You
was
watched the
late from my
YouTube videos?
duty. That's why.
Okay. You
Yeah.
watched the YouTube videos?
Yes. Yes. So
Okay.
yesterday she taught us about uh obstructive lung disease and I think asthma.
Asthma.
Yeah.
Yes.
So you
Mm.
watched?
Yes. Yes. I attend the class yesterday. So ma'am
Okay.
was said like that. You people are build one group and do something and discuss something. Then only your knowledge get grow up. Then only
Okay,
you
one thing
knowledge.
I want to discuss with you, don't you think whatever ma'am taught us, it's like completely basic one? And like I feel like it's not like we do not get the what kind of question we can get in the NCLEX exam, or like it's like a
Yeah.
basic we just learn in our BSc nursing.
Yes. Um, the question will come like nursing care, only the nursing care, then scenario based questions,
Yes.
like that
You know,
only.
the
Hmm.
last teacher, the Captain Suruchio,
Yes.
she will,
Hmm.
I think her pattern of study is good as compared to, this. Because we have grabbed lots of knowledge through rationals, right? And also we just go through what kind of questions we get in the NCLEX exam, right?
Hmm. After 3 to 4 months, they will conduct like mock test only daily. So
Yes.
so that time easy for us.
But we cannot, but it's like a free class, so we cannot every time object like, right?
Sure.
But
Absolutely.
overall, it's like good for us. Like we just get a free class from, good teachers.
Yes.
That's a good opportunity for us. So where are you live? Like
I'm in India.
you are in India,
Yes,
Kerala.
yes. No. Not Kerala, Tamil Nadu.
Okay, okay. I have
Mhm.
lots of friends from Kerala because when I was working in hospital, at that time I just met a few of my friends. They are from Kerala.
Okay.
So which country
But
are you
but
planning?
no, I'm not planning country to go.
Oh,
I complete NCLEX exams. One of the process is there. Here like a medical reviewer or medical lecturer. Like
okay.
I want to
So
do that.
okay, so you have no plan for to go abroad.
Oh,
That's cool. And actually, it's good to give, as a lecturer, you will work
yeah.
all the best.
Thank you. You are in?
I'm also from India, but my husband, he's living in Australia. So now we are just waiting for our PR.
He has
So
also he is also Chennai. Sorry. He is also nursing.
no, no, he is in IT sector.
Okay. Rupa ka was husband also IT sector.
Yeah, we both like a same one.
Yeah.
Hi, Rupa, how are you?
Good morning. How are you? Thank you.
Rupa speaks very calmly, slowly.
Ah.
Good.
I lost my glasses. I don't know how I'll manage today. Those are reading classes.
I think ma'am is here now.
Yes.
I think how many are there in our class? Usually.
I think approximately
13, 14.
yes, around.
But maybe we should make a one WhatsApp group instead of, because of that one there are 70
Yes,
members.
ma'am said yesterday, no, ka? Ma'am said yesterday, no?
It's nice we can make a group just in our class,
Yes.
because some things we can't
We have
discuss
to discuss.
Actually, ma'am
Ah.
is the only one who can make the group because she knows that who all are join the class. We don't know.
Okay.
Recording in progress. Good evening, ma'am. How are you?
Good evening, everyone. How are you all?
Fine, ma'am.
Fine.
Good evening, ma'am.
Bhavna, good evening. Priya, Rupa, Dhurmi, Moon,
Ma'am.
Munij.
Good evening, ma'am.
Good evening, Mr. Susan. So, yes. Okay. How are you all?
All good, ma'am.
Fine, ma'am.
Fine. Fine. Okay. So, did you study whatever I have taught you yesterday?
Yes, ma'am.
Okay, cool. So, are you excited for today's class as well as you were yesterday? I know yesterday's class was very, very long and very, very informative. So you must have been very much saturated with the knowledge. Yes, Shashikala.
Yes, ma'am.
I really appreciate your efforts that you're always on time, camera on. So I really like students who keep their camera on. They're always, you know what? I don't know. I was studying some kind of community in Africa. So the people say, the higher we jump, the closer we reach the God. Yeah. So same applies to our class. The nearer you are to me, the better chance of getting past the exam. So you can just correlate that. Bhavna, Mugdal, are you agree? Do you agree?
Yes, ma'am.
Where are you, Bhavna, currently?
Ma'am, I'm in India.
India.
Delhi. Delhi.
Oh, which part of Delhi?
Pitampura.
Oh, do you know that army camp area?
Delhi Kent?
Yeah.
Yes.
Nearby.
My father now he's retired. He was working in Delhi Kent, that army defense.
Okay, my father is in army. So which part? Gopinath or Sadar Bazaar? Your
No,
father was
it's proper in Delhi Kent. The base hospital
yes. Base
nearby.
was.
They have defense
Yes, defense.
Ministry of Defense office.
Ministry of Defense is basically in It's near cannot place, basically, if we talk about. But yes, there was some, there is base, and this is the platform.
Yes, ma'am. There is one office as well in Ministry of Defense, back of base hospital.
Yes, that is Gopinath. So your mother.
Before that, he's in Hisar. Then his posting is in Delhi. For like last 4 to 5 years, he's in Delhi with us.
So you do you get chance to go and meet him?
No, we are in Delhi. So
You
yes, when he was living in Hisar, at that time we just met him like in on weekends only.
yeah, I know Hisar. I have like when I was very young, like 3 or 4 years. So my brother was born in Hisar, Kant. I like the Hisar part. People say it's like in Haryana, but it doesn't look like Haryana to me. It's good.
It's like big place.
Yeah, it's a good place. Good place to be in. So you know Dholokwa?
Yes.
Do you know that APS Dholokwa?
Yes,
Unpublic-
ma'am.
So I'm a student of that. So I'm an alumni of APS Dholokwa. Yeah, it's the biggest school of like I will call it Delhi. It was a very good elite school. I miss my school. Do you all miss your school?
Yes, I
Yes,
passed
ma'am.
out from KV, Kendriya Vidyalaya,
Which KV you passed out from?
Pitamburai.
Okay. I was there in one year KV number 1. What KV number 1? KV number 8, sector 8.
Oh, yes, yes.
Sector 8 KV of that
There
was
is KV, Sector 8.
sector 8 KV of
Rohini.
not Rohini.
Okay.
It's in that Malai Mandir, if you know that part of. Okay, it's very, very far, but I like KV also. KV was good. My friends were from, most of them are KV.
But nowadays it's not.
Don't say this thing. Back then, KV was a good, like APS.
Actually,
CPS
school
and
is good, but the nowadays children are like
KV.
too much.
Yeah, I know everyone will feel very outdated with this communication, but we were just recollecting our past memory from Delhi. So, Sashika, are you from which state?
I'm from Tamil Nadu, ma'am.
Oh, it's currently in Tamil Nadu.
Yes, ma'am.
That's cool. And Rupa, back then in India, you're from where?
I'm from Andhra Pradesh, ma'am.
Andhra Pradesh and Tamil Nadu. Are you good friends? Are you good friends?
I know Telugu, little.
Yeah. Rupa, in
I
meanwhile, you
was
can just communicate. You have to keep smiling. I don't know, Rupa. You're always there in my class. I really appreciate, but you have to become very normal and chill, okay? You're always stressed. I feel like, oh my God, I have to do this, that. You're always stressed. There's no need to be stressed, okay?
okay, ma'am.
Okay,
Thank you.
cool. Will you listen to
Yeah.
me and keep smile from now on?
Mhm.
Big, keep
Yeah.
natural smile, not pressurized smile. Okay, so Priya, you're from Haryana?
नहीं मैम न्यू दिल्ली
कौन से कहाँ से?
तिलक नगर
Arey, Tilak Nagar. You know what? My whole childhood was in Tilak Nagar. There's a book market over there in Tilak Nagar where I used to get second-hand books, and I used to read from that Tilak Nagar metro station. So
यस मैम
I can feel now in Delhi vibes over here. So anything related to Delhi, we can discuss. We have 3 groups, okay? So Dhurmi, Monjo, and Farhad. Farhad is from Pakistan. Dhurmi, you're from?
Hi, ma'am. I'm from Gujarat.
Oh, Gujarat. I
Yeah.
have my friend. Yes, now I can see you, Dhurmi.
Yeah.
Food is awesome.
You're still in Gujarat right now?
No, I'm here in Canada. Like I'm living in
Okay.
Toronto. Yeah.
Toronto. It's cool. How's Gujarat? One of my friends is from Gujarat. So I know like not much more than Gujarat, but yeah, something about Gujarat. Some dhokla khandi and
Yeah, it's
my
about the
good
food
foods to
only.
eat. Yeah. Now I like there's one more sweet dish. What we call it that ghevar. Ghevar is from Rajasthan, no?
Yeah, it's from the Rajasthan.
Rajasthan.
Like mostly in the Jaipur or
Yeah.
that part of Rajasthan.
Nowadays we are eating this ghevar because
Ghevar.
तीज पे होता है वो मिलता है.
हाँ, 30 पे होता है. Okay, Monjo J, you're from?
Ma'am, firstly, you do not pronounce my good name.
Okay, it's okay.
My,
I'm so sorry. What's your name?
My name is Emmanuel, but nickname is Mano Jazzy.
Acha, Mano. Oh, I can call it Mano. I didn't know. Okay, Mano, are you cool with Mano?
Mono pronunciation spell like M-O-N-O, Mono. But
Yeah,
Mano,
Mano.
M-A-N-O.
Okay,
Mano Jazzy.
Mano. You're from Mano?
I'm from Pakistan, madam.
Okay, so don't worry. I have watched so many Pakistani dramas, so I'm very well aware of what's
I
happening.
know that.
I'm big fan of Pakistani drama and music and taste and good
But,
food. Which
but
which part of Pakistan you are from?
I'm from Peshawar, Pakistan.
Oh,
Peshawar.
Peshawar.
Yes.
Good, strong bloodline.
KPK, Khyber
Warriors.
Pakhtunkhwa.
Yeah?
Khyber Pakhtunkhwa. Our province name is Khyber Pakhtunkhwa, KPK.
Okay, good. I have heard about Peshawar that they're very strong, good, strong. So can I know about Unza, Uzma, and one more? Farhad is
I am Uzma. I am from Pakistan. Or live
yes.
in KPK, Peshawar.
You are also from Peshawar. Cool.
Yes, ma'am.
Yes. And Farhad, you're from?
Yeah, ma'am, I'm from Karachi.
Oh, Karachi is capital of Pakistan, right?
No,
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 it
ma'am.
is Islamabad.
Oh,
It is Islamabad.
Okay, Karachi.
But few years ago, Karachi is also capital of Pakistan.
I think
But
I read it somewhere. That's why no, I just heard it, not
sorry.
read it. So I thought Karachi. Okay, cool. So we know where we are from, and we are so strong, powerful, and we hold so much of inheritance into us that it should be visibilized in our learning and everything. So okay, starting with okay. So let me tell myself. Do you know where I'm from? Basically, I was India. So, and my father was in army. So I have been to many different places in my life. But preferably in Delhi was my good zone. And then, so currently I'm doing my master's from USA, California. This is all about me and teaching you.
My father was also from Army,
Yes,
Pakistan Army.
Pakistan Army.
And what are the basic requirements for masters in abroad?
Oh, it depends which course you are in.
Like if I want to pursue masters in psychiatry.
So you have to clear your NCLEX first. So like then you have to have some hour of in
Work
your
experience.
yes in USA. If I'm talking about USA, then only you can appear for that psychiatry.
Okay. So in USA, like 1 year of masters or like 2 years?
Yeah, 2 years. Masters are 2
2
years.
years.
Yes. Even my master's is of 2 years. Okay, cool. So let's study. Can you all see my screen? Yes.
Yes, ma'am.
Okay, let me show you more. Okay. Okay. Can you tell me what we have studied yesterday?
Respiratory.
We study about obstructive lung disease in which we have asthma, chronic bronchitis, emphysema, and bronchiectasis.
Okay.
And studied about an asthma.
Yes.
Yes.
Other than that, we studied about drugs,
Yes.
bronchodilators,
Types of asthma,
anti
signs
anti
and symptoms,
anticholinergics.
Common symptoms.
diagnosis,
There's
and
diagnosis.
respiratory drugs.
Do you all remember what I have taught you without any looking
Yes,
at the notebooks?
Yes, ma'am.
So let's start. So today's topic is going to be your chronic bronchitis. Okay, starting with the topic, like we have discussed about, I'm still in obstructive lung diseases. I'm still talking about obstructive lung diseases. And earlier I taught you that trachea is further divided into bronchi, is further divided into bronchioles, and you have to repeat with me. Bronchioles are further divided into primary bronchioles, then we have secondary bronchioles, and then we have tertiary bronchioles, and then we have terminal, and then after terminating bronchioles, we have respiratory bronchioles, and then we have alveoli duct, and then we have alveoli. This is the all three branch that we should know this thing. So we have, yesterday we have talked about that the problem which starts over there in trachea and bronchi,
Yes.
that is this asthma, right? We have discussed about asthma. Okay, so right, one more thing about asthma that is very, very important, that is known as status asthmaticus. What is this? Status, repeat with me, status asthmaticus. Okay. So how will you know a patient is having status asthmaticus? Asthmaticus. Okay, status asthmatic. First of all, you can also write it as acute asthma exacerbation. Okay, you need to understand one thing. Whenever I say exacerbation, you can call it exacerbation, whatever you know, but you should be very clear with this word, that whenever I use this term exacerbation, it just means that any condition is getting worse. And worse means not worse in a very small fraction of time. For example, I might have an asthma right now. I would live a very happy life, normal life, but if I get triggered, and just imagine in 15 minutes, my airway get blocked very completely. And now I'm having no wheezing sound. That means my condition has been deteriorated at such a state where there is a life-threatening condition has occurred to me. Even if I call it as like status epilepticus or status asthmaticus, exacerbation of epilepsy, anything. Exacerbation means any situation has become very, very severe to us. Now it is very, very life-threatening to us. So we call it as status yes, asthma exacerbation or status asthmaticus. And understand one thing, and this is life-threatening condition. Number one, it's going to be your medical emergency. Okay, asthma itself is not a medical emergency, but status asthmaticus is a medical emergency. So how will you know a patient is having a status epilepticus? First of all, you can ask the patient to blow through this peak flow meter. Very good. Peak flow meter. Okay. With that, we have so it might come into red zone. Okay. The patient's vital sign has been changed. Their heart rate has increased. Their respiratory rate has increased. There's a decrease in SpO2 level. So these are they are the cardinal signs. Okay. And patient is just breathing like. So you can see visually that the patient is having so much a problem in breathing. So we have Loveness over here. Loveness is my old student. I'm so sorry, I can see her face. So Loveness is from Africa. She's a mother. She's a beautiful soul, as well as she's a very kind person. So she will be in our class from now onwards. Loveness, you have to be in my class regularly. Okay, this will be the time. Okay, understood? Okay. So you have one more friend. She might be coming, and she is also from Africa. So you can have a company. Okay. Okay, so cool, let's start. So I'm talking about your status asthmaticus, where there is a visible change in a respiratory system, a heart rate, and there is a effort breathing. Patient will put so much of efforts in breathing, as well as there will be heart rate, and there will be use of accessory muscles. What are the accessory muscles of respiratory?
Intercostal muscle.
Very good. Intercostal muscle, sphenokeloid muscles we have. Okay. Understand one thing very, very clearly. You have an condition, even whenever you say this term in your NCLEX, that the patient is unable to speak. Patient is unable to speak. This is a high priority, because understand one thing, as you have your nose, then you have pharynx, and then you have larynx. Pharynx has been divided into how many part? How many part? Farhad?
3.
Farhad, pharynx कितने part में divide होते हैं?
3.
What, ma'am?
कौन से? Pharynx has been divided into how many part?
Ma'am, 3, but I don't remember the names of the other parts.
Okay. Nasopharynx, oropharynx,
And
laryngopharynx.
laryngopharynx. Yeah, okay.
Pharynx has been divided into 3 parts: oropharynx, then nasopharynx,
Nasopharynx.
laryngopharynx. Okay.
Laropharynx.
Yes, and this your larynges are what your larynges are basically? These are your voice box. Okay.
Voice box.
Yes, they have vocal cords. So cords are like this, vibrating like a membrane or tissue. So whenever air passes through them, whenever air passes through a narrow tube, and there's something in the vibrating, so it will produce sound. That's why we speak. That's why I'm speaking. Okay. So whenever there has to be an air movement in order to speak, and just imagine if I block this tube, will air pass?
No, ma'am.
No. If air will not pass, it means that a patient cannot breathe. And the patient is not breathing is a classical sign. Patient is not talking, or patient is unable to speak. This means a patient is having, the blockage in the airway. Understand? This is a very crucial line. Okay. Diffuse, either patient come with you with a diffuse wheezing or absent wheezing, or there is an absent wheezing. Okay. There might be a change in the ABG value. Okay.
Yes,
So
ma'am.
in ABG value, if we check your ABG, there will be increase in partial pressure of carbon dioxide or decrease in the partial pressure of oxygen. So these things can happen. Yes. Okay. Understood? So this is the sign and symptom of a patient. A patient will be very, very irritated. Okay. And the patient cannot breathe. He will just like, the patient will still be in a tripod position, and the patient will lethargic in breathing. Patient will use accessory muscle. The patient can't talk. There's a change in you can visibly heard wheezing sound or absent wheezing. So these are the crucial important signs that the patient is going under your status asthmaticus. And and you can also say that this is not being treated with, like, even after giving albuterol, the patient is still showing the sign and symptom of respiratory blockage. Okay, this is also one important point. Like, even after you have given your rescue inhaler, that is an albuterol, even after giving albuterol, the patient is showing the same sign and symptoms. So this is a very very important. Okay, then how will you manage this thing? The first treatment, okay, understand the treatment. Treatment is going to be first.
Ma'am, is it like status asthmatic treatment?
Yes, status yes. This thing. One thing I want to make this sure in very clearly. Yesterday we have discussed about 2 types of drug. First type of drug was related to your bronchodilators. Yes. And second was anti-inflammatory. So if you give, for example, I'm giving you 2 drugs, Shashikala, betamethasone and albuterol. So among this thing, which drug will you first give to the patient?
Albuterol.
Albuterol. Albuterol.
Shashikala, no. You were on a betamethasone. Go stick with your answer, okay? Why will you give albuterol first?
Ma'am, because it will dilate the bronchioles. Then corticosteroid will work better.
Very good. I just wanted to listen this answer. For example, in order for your Beta-methazone to act, need to have an open airway. Okay. So first you will open the airway by giving bronchodilator. Then you are going to give the anti-inflammatory drug. Understood? That's why we're going to get this. Okay. So even if you're giving the status epilepticus, we have to give bronchodilator in the form of nebulizer. What will nebulizer will do? It will have a more systemic effect.
Right.
Like not a systemic effect, it will have a more a local effect. So when you take in nebulizer, what is nebulizer basically? It is a mist with air, which have more permeability, which can easily go into your lung and stay for longer time. Okay. So bronchodilator with the help of nebulizer. Understood?
Yes.
Next, you can give nebulizer with albuterol. Yes, albuterol, Saba. Okay.
Sabalaba.
No,
No,
long
lab.
acting you're not going to give. You're going to give always short acting in status. Then you are going to give ipratropium bromide. What is ipratropium bromide?
It is a
Everyone.
maintenance therapy. Maintenance
No.
therapy with albuterol.
Other than this, what is the class? Whenever I ask you a drug, I'm expecting you to give me the class of the drug. Which class this drug is from?
Beta 2 antagonist.
Anticholinergic.
Anticholinergics. And you should know anticholinergic side effect on your tips. Most asked question, highly repeated question, and definitely you're going to good. Okay. You can also give corticosteroids.
Yes, ma'am.
Methylprednisolone, prednisone, they are very effective. And if it's not being treated, then you can give patient on BiPAP, non-invasive partial pressure ventilation. Non-invasive partial pressure ventilator, you can give what is BiPAP. Okay, what is BiPAP? Anyone? What is BiPAP?
Continuous air pressure. It's a continuous air pressure. No.
Yes.
What is
Ma'am, it is a
BiPAP?
non-invasive.
CPAP.
Ma'am, it is a non-invasive method to maintain patient breathing.
Why?
Did you have heard about BiPAP and CPAP? Continuous positive pressure. Bi-level positive airway pressure, BiPAP and
That is
CPAP.
a
Okay.
negative and
Ma'am, I
positive.
heard it, but
Yes.
That is a negative and positive by pressure, positive pressure.
Yes. So what this BiPAP basically
That
does?
is a removable device.
Yes.
When we have no any invasive like a ventilator available in our ward,
Yes.
in that condition we should take for BiPAP, removable BiPAP machine.
Okay. So let me explain you. This bi means two. Always bi means two. Bi का मतलब दो होता है, सबको पता है. Bi means two. Okay. So what happened in BiPAP machine? So there will be two forces that are available. So one, listen. Okay. Let me show you. It will look like this. Okay. This is the machine. Just a simple machine, just not costly as ventilator. Okay. It is attached to the oxygen, and over here there is one mask, and very pressurized mask basically.
Pressurized, yes, ma'am.
Yes, very pressurized. So it has two things to do. First, it push air into a lung with high pressure. Okay, first thing. Second thing, it remove the carbon dioxide from your lung also. So your body do not need to like put efforts in order to breathing. So machine do the efforts for the patient. Okay, so it has two pressure. It will also provide you oxygen as well as it will remove carbon dioxide of your body. Similarly, CPAP is basically used for sleep apnea. Okay, and it only provide you with certain amount of pressurized air throughout your breathing. So by pressure have two pressure: inhale pressure and exhale pressure. Okay, so you can give BiPAP. Okay. So this was all about status asthmaticus. Okay. Then you can also keep patient on ventilator. Obviously, the end result is ventilator. Okay. Next. So this was all about status exacerbation or status epilepticus. You can call it any way you wanted to call it. Okay. Let's talk about today's important, the topic that we have to discuss is COPD today. So we are going to discuss about, so this is all about asthma. Okay. And then now we are discussing about COPD. So not COPD, but
Chronic bronchitis.
Yes. So now we are talking about chronic bronchitis. Okay. Any favorite color, anyone? Okay, let's talk about chronic bronchitis. Okay, so you have to understand what is this chronic bronchitis is. Let me explain you this thing. Okay, so as we have discussed earlier, this is your airway, and if I say this is the lumen, okay, and this is the, I'm making an airway. Rupa, did you share any file in the group?
Yeah.
Which file it is? Can I have a look? Can I look at this file?
Can you maybe?
CPAP, BiPAP.
Oh, CPAP, BiPAP. Yeah. Yeah, cool. Alexa student who put efforts and make things easy for me. Okay. So what is this? So this is your, what is this? Which layer is this? Just the first lecture I have taught you. What is this? Anyone?
This is airway.
This is the airway.
The
And the
lumen.
cross-sectional view of an airway. I'm just making a cross-sectional view of your trachea. So this is your mucosal layer. You can call it submucosal layer. And this is your muscularis layer. And this is your adventitious layer. Okay. This is what you know. Do you understand this thing? Okay. Understand one thing. This is made up of columnar epithelial. And there's cilia present. If I cut your airway like this, if I just cut you over here and see the cells, it will look like this. Okay. Okay. Now what happened? Over here. Over here, they will produce mucus. Yes or no?
Yes, ma'am.
Okay. So mucus will travel into this lumen. Okay, this is actually normally what is happening in the body. So what exactly happened in chronic bronchitis? It is a persistent cough with exponent. It is a persistent cough with exponent more than 3 months a year from last 2 to 3 years. Exactly, let me explain you more. So you can write a persistent cough
With exponent.
More than 3 months a year. More than 3 months a year. Lasting from last 2 to 3 years. So a persistent cough with exponent more than 3 months a year from last to 2-3 years. So what's happening? A patient is coming to you and saying कि मुझे ना बहुत ज़्यादा खांसी होती है. I'm just coughing from I'm having cough like since 1-2 months continuous. Sometime I'm having it more, sometime less. So persistent cough from 3 years, like 3 months. Okay. For an year. So like कभी होती है, कभी नहीं होती, कभी होती, कभी नहीं होती. The patient, the classical sign and symptoms. And if you take the history of the patient will say कि अच्छा ना बहुत सालों से हो रहा है, पहले बहुत कम होता था, थोड़ा बहुत दवाइयां लेती थी, मैं ठीक हो जाती. So the patient have a classical history of this. And the patient will come to you with if you ask more history of a patient, the patient will say that I am a smoker. The patient will have an history of smoking associated with. Okay, are you at a point that you ask the patient what your history? The patient will say, I'm having cough since so many days, so many months. So if you ask more history, the patient says, okay, the last year I had also had the same problem, but I took some medication, some over-the-counter medication, it went, but now again I'm having this, again I'm having this cough. So this is exactly this case is of chronic bronchitis. And when you will study about chronic bronchitis, here come an exactly pathophysiology of disease is when a patient inhales smoke. When a patient is patient is smoking since a long time, since a long time. So okay, let me add one more thing. The patients of chronic bronchitis comes with an usual age of like 40, 45, 50s. So this progression of disease will show at this period of their lifetime. Okay, so what happened? They were smokers since a long period of time. Okay, so what basically present in the smoke? Can anyone tell me what is smoke is?
Nicotine.
Nicotine, yes.
Steam, tobacco steam, which is very harmful for the lungs.
Ma'am, it has nicotine, it has tobacco.
Yes, nicotine, tobacco, and some soot particles, some strong chemical. Okay, do you know about two things in India or Pakistan? I think it's very, very common in the side of India. So we have BD, we have cigarette. Yes or no?
Yes.
Yes,
Yes.
What is the difference between a BD and a cigarette? Anyone knows?
BD, I
No,
think not having any filter,
Yes.
but cigarette having filter.
Yes. So the companies which make smoke or they sell you cigarette, but they say, take my cigarette or take my BD, I have a better filter. So you might get being protected by cancer or more better, but you still have cancer. But if you use my filter, you will get less cancer. If you use BD, simple BD of 2 rupees, you will get cancer. In the both way, you are getting cancer. So there is no going back. So they fool us like this way. Okay, so what happened? When you will inhale smoke, so smoke act as a trigger. Smoke act as a trigger. So this gland will increase in number. Okay, this gland will increase in number because they understand that for us, for our body, smoke as an act as a very damaging to the body. So in order to protect our body from the smoke, our glands increase in the size. Okay, so there's two things happen. Hyperplasia is happening and hypertrophy is happening of your glands. So two things is happening due to smoke. Hyperplasia means, what do you mean hyperplasia? Anyone?
Ma'am, increasing the number of cells.
Very good. Plasia means increasing in the number of cells. What do you mean by trophy? Hypertrophy?
Is increase in the size.
Very good. You know, have you ever like what is a tropical trophy? Trophy means increase in number. Okay. Increase in the size is your trophy. Trophy means the size will increase as well as number of your cells will increase, and there will be increase in the size and number of these small mucosal glands. Okay, and then they will get in highly activated. They produce lot of cough, and cough will trigger your cough center. Okay, when there was something in the mucus, there is a cough center in your medulla. Okay, so you will cough so much. Okay, so this will increase in mucosal layer, and this will hence increase in your secretion. So do you understand what exactly chronic bronchitis is?
Yes, ma'am.
Yes, ma'am. So what is the classical causes of this disease, chronic bronchitis? Smoking. Okay. One thing I'm giving you homework, when I will give you break after 20 minutes. So you will learn about Virchow triage triangle. Will you learn about Virchow triangle? Everyone, I will ask everyone individually. It should be in your notebook, this Virchow triangle. Okay. They will you understand what smoking exactly does to your body and how harmful it is. Okay, Rosaline?
Yes, ma'am.
Okay.
Yes, ma'am.
So smoking is number one cause? Yes, smoking is number one cause. Apart from the smoking, you have one thing called as bisonosis. Binososis, you can call it anything. This is the spelling. Okay. So basically, BYSSINOSIS. Listen, I'm not good with handwritings, so please you have to just bear with me. Either I can change
Mine
my
is
handwriting.
worse than
Sorry?
Is it possible for any factory as steam or a huge level of chemical factory, they producing a steam or and their employer are affecting from a COPD?
Yes,
There is
that's what I'm
another
talking
cause.
about this thing. No. So what happened this apart from smoking is one more cause, but apart from smoking, this is called as bionosis. It is basically happening in the cotton mills. Okay. The cotton mills. So what happened, this cotton mills, they use the cotton when we just beat the cotton. I don't know what we call it. When we just want to make the cotton more fluffy, when we beat this, so the particles diffuse in the air when it goes into our airway, and it can cause COPD. Smoking, bionosis, infection can also cause. So bacteria. Yes.
Yes, respiratory infection, recurrently.
Yes, recurrent infections, recurrent respiratory infections. But in your NCLEX, you will most probably they're going to ask about smoking. So smoking is the number one leading cause of chronic bronchitis. Okay. So what basically is happening? Okay. You understood the pathophysiology. You understood the causes. Can you just tell me the signs and symptoms?
Cough.
Difficulty in
Severe cough.
breathing.
Yes.
Difficult.
Dyspnea.
Severe cough.
Wheezing, very good. Wheezing, persistent cough
Persistent
with
coughing
sputum,
with exposure.
with
Productive
exposure.
का
Yes.
में white, yellow, green sputum होगा.
Yes. Recurrent respiratory infection. What happened? Basically, okay, listen, how you were having respiratory infection. Okay. So due to the smoke, there was so much of due to the smoke. So in your airway, there is so much of smoke. Due to smoke, there is so much of sputum. So what will happen? This sputum will stay in your airway, and then the bacteria from we are living in environment, so there are so many bacteria around us. So when we inhale bacteria, usually we do, so they will get stick to this sputum. They will get a breeding ground. So what exactly bacteria want? They want food, water, shelter, and reproduction. The basic human need. Same needs are with the bacteria also. So they want food, nourishment, shelter, water, reproduction. So they will do the same thing. So they will sit, they will eat, they will drink, they will enjoy party, they will reproduce, and you will get. And in order to reproduce, and this order when they are doing their parties in your airway, so they will produce exotoxin, which is very toxin for us, and we will get sick. Okay. Yes. So we are giving a breeding ground for bacteria. Okay, come on, you play with my lungs and my alveoli. This is all for you. Okay. So we don't have to do this thing. Okay. Infection. Okay. Apart from infection, we have a recurrent respiratory infection. Okay, one thing I want to make sure that you understand this thing. It will have a classical feature of blue blotters. Achha, what do you mean by blue? Is this blue for you?
Yes.
Blue blotter. Blue blotter. Okay.
Is it the sign symptom, ma'am?
Yes, blue blotter. Okay, blue means blue color. What happened basically when there is so much of secretions present, so they basically decrease the diameter of your airway. Okay, so there's less air which is present in the body, and which can lead to a cyanosis. Whenever there is cyanosis and very persistent cyanosis in your body will appear blue. And blotter means a big, the patient will become very fat. Very fat. Why blotter? Why blotting will be there? Because just imagine when we exercise, okay, our body consumes oxygen. Okay, but our lungs are healthy, so we can do exercise, we can run, we can just do our errand. But basically, when a patient is having problem in their respiratory, there's no passage of air. Okay, the body is not getting oxygen. So like, for example, if you ask them to go for a run, they cannot go. So they cannot do their daily chores. They cannot go for some heavily activity that we should actually do. So they're not doing.
Thank
So they're
you.
sitting. Loveness, you need to just let me complete myself and then you speak. Okay. So they're sitting for a longer duration of time. So when they're sitting for a longer duration of time, their body is not doing anything. Hence, what is happening to them? So they're sitting, there's increase in the weight, and they're always coughing, and they're using their accessory muscles, their respiratory muscles, they're having respiratory fatigue. Okay, so these are the signs of blue blotter. Yes?
Yes, ma'am.
Okay, yes. Cool. One thing, they have one specific classical feature of right-sided heart failure. So let me make a good, okay, let me make your lungs. This is your beautiful lungs. Everyone have 2 lungs, okay? And this is your heart. Everyone they have heart, okay? So what is happening? Superior vena cava, inferior vena cava? Yes or no?
Yes, ma'am.
Okay, this is your right atrium, right ventricle. From your right ventricle, the blood is moving out into your lungs. Yes? Through your pulmonary.
Pulmonary vein.
You just tell me, vein or artery?
This is pulmonary artery, ma'am.
Very good. Pulmonary. This is pulmonary artery or vein?
Artery.
Pulmonary artery.
Artery.
Okay. So anything which takes blood away from your heart is called vein. I know you have in your childhood, you must have heard that, okay, the veins contain deoxygenated blood and arteries contain oxygen. But this is a very misnomer. Like, honestly speaking, when we studied, like when anatomy was being written on the books, when earlier the doctor and the scientists, basically doctors, physician, they started understanding the human body, and in the literature, they have, if I'm talking like very, very in depth, and you have to understand this thing. So when they started writing literature about human body, they have said that anything which is carrying blood away from the body, we will call it a vein, and anything which is bringing back to the heart, we will call it artery. Okay.
No,
So
ma'am, is it?
I'm
Ma'am,
saying
no, ma'am,
either,
bringing back to the heart is vein.
yes. When
Yes,
anything which is bringing back to the
heart is vein and taking away is artery.
anything which is taking blood away from your body is your artery, and which is bringing back to your heart is just called vein. So this was the actual concept of naming the vessels. Okay, so that's why this blood is taking blood out of the heart. That's why it is called as artery. Okay, artery. And this is called bringing blood back to your heart. That's why this is called as pulmonary vein. Now you understand?
Yes, ma'am.
That's why. Okay, so understand one thing. So superior vena cava, inferior vena cava, blood will go over here, and from pulmonary artery, it will reach to your heart. But now understand what is happening over here. There is so much of congestion in your airways that there is too much of pressure in your lungs right now. So there is too much of pressure in your lungs. That's why the blood cannot get fully into your lungs, and that will going to build back into your right ventricle. Basically ventricle. And there is right ventricle hypertrophy associated with chronic bronchitis also. Did you understood something? Okay,
Yes.
let me explain you this thing again. What I'm exactly
Right ventricle hypertrophy.
Yes. Why this ventricle trophy is happening? So this is your lungs. Okay. Okay. This is your heart. So as we have, there is so much of congestion over here. So there is so much of positive pressure. Okay. So whenever the blood, which is taking your blood to your lungs, which is called as pulmonary
Artery.
Very good, pulmonary artery. So when there is too much of pressure, though blood cannot get fully into your pulmonary system. Yes, pulmonary system. So blood will be back into your right
Right ventricle.
and this is called right ventricle hypertrophy, which is also called as cor pulmonale, which is also known as cor pulmonale.
Pulmonary.
And you know what this cor word is associated with what? So what happened?
Filled with water, ma'am.
No, not water. Okay, this core word also come from a very history also. So when the physician looked at the patient's heart, or when they dissect the patient who died with chronic bronchitis, so when they saw their ventricles, it was very big. It was very big because there was a right ventricle hypertrophy due to blood pooling. So they had said, okay, this heart is looking like an heart of a cow or an ox. So the synonym of your core is come from an ox or cow. So there's like, so just like iske jaisa aisa dikhta hai na, so they started like core pulmonale, like a lungs of a cow or cow. That's why they call it cow core pulmonale. Okay, this is the origin of this word, core pulmonale. Like core, like an heart of an ox, because they have a very big heart chamber. So that's why they call as core pulmonale. Okay, pulmonale related to the lungs, as lungs, and now core means heart. You can just call it core. Understood? What are the signs and symptoms? Can anyone tell me now? Because core pulmonale, right ventricle hypertrophy, you should understand. First sign and symptoms.
Edema, sputomegaly,
Respiratory
that's all.
acidosis.
Respiratory acidosis, yes. But initial signs and symptoms start with shortness of breath, cough, yes, exhaling muscles,
respiratory, high respiratory rate,
yes,
mental status changes.
But these are very, very late sign and symptoms. Okay, very, very late sign and symptoms when your body is deprived.
I'm asking about every sign.
Sorry?
Cyanosis.
Yes, cyanosis.
Hypoxia.
Hypoxia, dyspnea, blue blotter. Blue bottle, right in capital.
Blue bottle.
Blue blotters. And feature of right heart failure or right ventricle hypertrophy, right side heart failure, which is also called core pulmonale. Okay, understood? So this was all about your chronic bronchitis. Okay, if I ask you, Rupa, what will the management of chronic bronchitis? What will say one management? Long-term management. I'm talking about long-term management.
Steroids.
Think like a nurse. Think like a nurse. Anyone can answer. If anyone can answer this question.
The first thing, because the
Bronchodilator, anti-asthmatic drugs.
Yes.
And
antibiotics.
Asking you, think like a nurse and just say a long-term management. A long-term management. A very, very long-term.
Salbutamol.
Respiratory support.
A more finer version of this.
Inhaler.
Oxygen.
Nebulization. Nebulization.
Inhaler.
Oxygen therapy.
Think you are just targeting the sign and symptom. Everyone is targeting the sign and symptom. You're not targeting the disease. As a nurse, as a good doctor, you should always target the cause. The cause.
Because we have to stop the
smoking cessation.
Smoking cessation.
Yes.
Smoking stop.
Yes. Think like a nurse. Long term. Okay, for example, a patient is smoking and taking oxygen. Okay, 5 minutes smoke oxygen, 5 minutes smoking. Is it going to make any difference? No. Smoking cessation is not an easy thing.
Yes, ma'am. It's like
put in
depressive.
Therapies.
You are asking about precaution.
Patient will go in depression as well.
Goes in depression as well for what?
Like if you want smoking cessation.
Yes.
Because patient is like depressive situation for him, like to quit smoking.
Yes, because you know what? Nicotine, somebody have told me that no, the smoking have nicotine. And yesterday, if you remember, I have told you about a receptor which is called nicotine and muscarinic receptors. So smoking affect your nicotinic and receptor, and this is the receptor which provide you calmness.
Yes.
Cholinergics.
One of my uncle, he is like smoking a lot. Like in one day, he just I think 6 to 7 times he smoked. And they just try for nicotine tablets as well, everything, but it doesn't work at all.
It doesn't work.
Ma'am, we can say that we are avoiding the exercise or a high carbohydrate diet.
Yes,
in
these also things
COPDs.
matter. But okay, whenever something, if
Gassy
question
food,
asks you about
high fiber
long term,
foods.
yes, whenever I listen, if there is an exacerbation of the situation, we would have gone for the cause. Okay, but if I'm asking you to treat something in long term, if I'm asking you to tackle a disease, you
And
should
ma'am, we are
always
also not given any live vaccine to the COPD patients in this disease. We can say that.
you have to give
In management, long-term management.
no, you have to give vaccination, especially you have to vaccinate the patient, okay, especially with your pneumococcal vaccine and influenza vaccine. Pneumococcal every
But
5 years, influenza every
I would
year.
read it anywhere in past study. One of my
have
teacher
just-
told me, we do not give any vaccine in COPDs.
Ma'am, I think it is only because if the patient is taking corticosteroid, to depress the immune system.
Yes,
Maybe that is
might
how
be
he is
this
thinking.
reason, but if I'm concerning about NCLEX asks you to take like immunization of pneumococcal and influenza every 5 years and every 1 year. Okay, in the month of October and November. This is very, and they have to get immunized because they are very prone for infection.
Okay.
That's why. Okay, and the patient is long-term therapy of corticosteroids. Then only we ask them not to take any kind of live vaccine. Only live vaccine. Okay, and this is all about. Okay, this is what we have studied about our chronic bronchitis. Next, let's talk about your emphysema. So the next topic is your emphysema. Okay, emphysema means permanent dilatation permanent dilatations of air spaces. Okay, distal.
Ma'am, what is complication?
Emphysema. I'm talking about emphysema right now. Okay, permanent dilatation of air spaces distal to the terminal bronchioles. Distal to the terminal bronchioles. Okay, and destruction of wall of dilated air spaces. Let me reframe this for you. So, did everyone wrote this thing?
No, ma'am.
Just write it very, very quick. Just be quick, okay? Let's not waste time in writing.
Air space.
Distal to the terminal bronchioles and destruction of wall of dilated air spaces. Okay, these two things. First is emphysema and second is emphysema. Don't get confused, okay? I'm talking about sema. Sema is a girl. Think like a sema. Sema is a girl, okay? Okay, let's come to the first thing that we have discussed earlier. So I'm saying permanent dilatation of air spaces distal to the terminal bronchioles. Okay, what is distal to the terminal? This is the terminal bronchioles?
Yes, ma'am.
Yes, ma'am. Distal, what is distal?
Ma'am, it is downwards like. I remember it like if something is away from the body, it is
very
distal.
good. We consider, okay, understood now. we consider heart as a center. Heart as a center. Anything which moves away from my heart is called and distal. If I compare my heart to my eye, okay, there are two things. One, my this is my, what is this? Anyone? Which organ is present over here? Thyroid.
Thyroid.
Okay, thyroid and eye. Which will be distal?
Eye.
Eye. Because this is most away from my heart. Okay. Consider heart as your center, and this will be my proximal to my proximal. This will be thyroid will be my proximal, and I will be distal. Anything which goes away from your heart is called distant. Anything which is near to your heart is called proximal. Okay, understood? These two terms. Okay, so distal will be this: respiratory bronchioles, alveolar duct, and alveoli. Understood? Yes or no?
Yes, ma'am.
Yes, very good. So distal will be your respiratory bronchioles, alveoli duct, and your distal. So I'm talking about these three things. Okay, now understand what exactly happens in them. So whenever a patient smoke, okay, let me ask you one more question. Do you anyone have ever heard of alpha trypsin? Never.
I heard it, but I don't know what it is.
Okay.
Yeah, I think
so
I read it somewhere.
Yes. So this is a very common term which comes, not a common term, but I'm just explaining in a very easy form. So there is some kind of protein which is present in your air. So there is a type of protein which is present in your airway. Okay, protein, or there is anti-protease. There is a protease and there is anti-protease. Okay, protease, anti-protease. You can also call it as elastins. If you have ever heard that your lungs comprise of elastin proteins. And then you have alpha trypsin. Trypsin. Okay. You can call it a protease, you can call it elastin, or you can call it alpha trypsin. Doesn't matter to us. It doesn't matter to us at all. Okay. So similarly, you have anti-elastin, or you have anti-alpha trypsin. So similarly, you have protease, elastin, alpha trypsin, and similarly, there is equal balance of your anti-protease, anti-elastin, and anti-trypsin in your body. And this antitrypsin is basically produced by your liver. So whenever a patient gets liver damage, it also affects your lungs, indirectly or directly. This is very, very in-depth. So what happened? So there is the protein in your body, which basically in your lungs. And then there is in smoke. Smoking, a patient is inhaling smoke. So what will happen? They will destruct this alpha trypsin. So they will destruct your alpha trypsin. And hence there will be a disbalance between alpha trypsin and anti-alpha trypsin in your body, in your lungs. So there will be a disbalance of alpha trypsin and anti-alpha trypsin in your lungs. So that's why it can lead to so these were the good, okay, let me just make it, then I'm making a terminal bronchioles, and terminal bronchioles is branching off into your alveolar duct, and these are alveoli. So there are alveoli, okay. Understood? This is the terminal bronchiole, this is the terminal bronchiole, respiratory bronchiole, and alveoli duct. So there are so many alveoli. So once there is a decrease or disbalance between alpha trypsin and trypsin, which is caused due to the smoking. So whenever smoking causes disbalance between this protein, so what happened? These two alveoli fuse with each other. They two fuse with each other. And when they fuse, what will happen? You know what will happen? They will, basically, what will they do? They will, the both. So what will happen? So can you see these three alveoli fusing with each other? And this is called as bulla formation. So there is a bulla formation. Understood? And this is the classical feature of your emphysema. And now what will happen? there is a bulla formation. Will there be a good oxygen perfusion? No, there will be a decrease in a VQ. V means ventilation and Q means perfusion. There is a disturbance between ventilation and perfusion. And this is called a classical feature of honeycomb-like appearance of your lung, which is caused due to your bulla formation. There is a bulla formation. A classical feature of emphysema, and the air will get rammed into this small bulla, and then you cannot expel air out of your body. Understood? This is emphysema. Anyone, any doubt till now?
You repeat this topic again?
Okay, let me explain you again. Okay. So what has basically happened? Emphysema is permanent. Okay, just mute yourself and prepare your room for it. Okay. So there is permanent dilatation of air spaces distal to the terminal bronchioles and destruction of wall and dilatation of air spaces. What does it exactly mean? It means that we have Villa Khan, which is busy in discussing so much of that. Okay. So what is happening? When a patient is taking so much of inhaling smoke, a patient is smoking continuously. So smoking destruct your alpha-trypsin. Alpha-trypsin, you can call it elastin, you can call it protease. Anything you feel like, you call it. So there's a decrease, there's imbalance between alpha-trypsin and anti-alpha-trypsin, which in turn damages the air wall of your alveoli. So your alveoli is like, you understand one thing. Over here, if I talk to these airway, okay. If you talk about starting from here to here, what basically, they have a very good support from other side, like they have a muscularis layer, okay. So they have a very good support. But as we are descending down, the wall are becoming very thin and fragile because their primary function is to exchange of gases. And the elastin helps them to make their good structure and size. Once there's a damage of elastin, what will happen? They will fuse with each other and they create a bulla-like formation of your where are we? Yes. So they make bulla-like formation in your alveoli, which is called as your bulla. The alveoli fuse with each other and make it as a bulla, which is called a bulla formation. Understood, everyone? Okay, and that's why there is air trapping in this situation. That's why we have air trapping. Understood now, everyone?
Yes, ma'am.
Okay, so let's come to the sign and symptom. What do you think the sign and symptom is going to be? Anyone?
First is bulla formation.
Yes, bulla formation. What? No, sign and symptoms. Symptoms.
Shortness of breath.
मैडम शॉर्टनेस ऑफ ब्रेथ होगी, wheezing होगी, chronic cough होगी, sinus होगा,
Yes.
weight loss होगा.
Yes. So you will cough. Cough will be there. Okay. Shortness of breath. Yes. You will have dyspnea. Okay. You will have pink puffer. What do you mean by pink puffer? Weight loss. Use of accessory muscle.
Yes, ma'am. Energy spent on
Energy.
breathing.
Listen now. Now there is a difference between VQ, that is your ventilation and perfusion ratio. Your body is not getting oxygen. And now you have to force your airway, force your body to put air into your lungs. Yes or no?
Yes,
Now
ma'am.
you have to do a lot of efforts. Okay. So this is called as your emphysema. Emphysema comes with a classical sign of pink puffer. So listen what happened. So your body is pushing you like, so there is an increase in the respiratory rate, your heart rate also to pump your so much of. But when we inhale and exhale, the body, the blood is also moving fast. If you understand, like if you're running and you're just trying to breathe, so your blood circulation is also increasing. So when the blood circulation increasing, your cheeks will become pink. So this is called a pink puffer. Understood? Pink puffer. So they're breathing like this. And literally they breathe like this. And I'm making you to, in order to teach you, I'm doing this way. So when a patient is having emphysema, they breathe this in this way. Okay.
We can say that
Understood?
high respiratory rate.
Yes, high
in a
respiratory.
pink puffer.
Yes, pink puffer, high respiratory rate. One thing, I don't feel good when I see only Rupa and Shashikala on my screen. This is not a good sign. Okay. I just feel like I'm talking to some
No, ma'am. We can hear you very clearly and
but I can't see
very
you.
intentionally.
But I have to also look at you all. Okay. Enamul, Bhavna. Okay. Because I feel like I'm talking to some.
Actually, ma'am, I am not. My reason is not turn on my camera because I don't know why I am not like a camera person, and these video recorded session also uploaded in YouTube channel. So
okay, this is the problem you're facing.
Most of candidate having this kind of problems, ma'am.
So only that is the reason. That's the reason.
Yeah.
Nothing like we are just.
Okay, but you have to understand that even I'm showing my face. Okay.
You're a professional teacher, ma'am.
I'm just a teacher. My profession, I have not yet discovered my profession. This is my hobby. When I teach, I feel happy.
So that's a great sign, ma'am. That's why you have a lot of knowledge. You can taught us
I love
very
teaching.
technically point of view. So that is great initiative for us, ma'am.
Honestly speaking, I have not yet discovered my profession. I have asked myself, okay, when I will turn 30, the day I turn 30.
No, ma'am, we are observing that.
Yeah, so you have to.
So technical person.
Yeah, you have to understand because, okay, this is the thing.
Actually, I want to listen the day you turn 30 then.
The day I will turn 30, I will ask myself, now Priyambada, you have to think about profession. Now you have to think about your life. And then I will do a job. Till the time I will experience, I will learn, I will teach, I will do whatever I love to. That is teaching. And I will continue to do this. Teaching and reading, studying. So this is my promise to myself. So this is what I asked myself. Like, okay, जब तक 30 साल के नहीं हुआ था, I feel like I don't have any responsibility in my life. It's just me and my small tummy that I have to fill. This is the God, and I am living in this world. So somebody else, like, I have my God with me always around. So I will never sleep empty stomach. And this is what exactly I want: a place to sit, sleep, up, food to eat, and student to teach, and teacher to learn. This is my life. So I feel like happy. Okay, this is what I'm getting. Okay, and obviously clothes to wear. Parents give. Okay. Apart from this thing, we have discussed about your chronic bronchitis, and we have discussed about emphysema. Okay. So let's talk about emphysema plus chronic bronchitis. So when we add to both of this, it will become a COPD. Now you understand what COPD is. If anyone asks you, what is COPD? Can you just explain what COPD is in your own language? Yes or no?
Chronic obstructive.
Very good.
Pulmonary
Chronic
disease. Pulmonary disease.
Pulmonary disease. Chronic obstructive pulmonary disease. Okay. Next.
Irreversible damage to the alveoli and bronchi.
Irreversible. You know how irreversible? Now there's bulla formation. How will we not make them go back to their original shape? Now they will not go back to their original shape. There's bulla. There's always so many of air spaces filled in your lung cavity. Okay. So now let's study about how will you manage like COPD.
Yes.
First thing one, we have to see the. Ma'am, today no break. No break. I don't know. Let me complete. When I feel like break, I will give you. So break depends upon me, how much I want to, when I want to. Okay. So do you want break? I don't think anyone needs break. We have just barely studied anything till now. So in order to in order to manage COPD, you need to understand exactly problem, what is happening to your body. The problem first is there is an obstruction in airway, the airway cannot flow. And the second thing, you cannot expel air or carbon dioxide from your body. So bronchoconstriction is the problem. Apart from the bronchoconstriction, you have the problem that in your air spaces, basically your alveoli, the carbon dioxide is not getting out. Okay, so in order to manage this problem, the mask, which is an appropriate mask, is your BiPAP. Okay, why BiPAP? Because it has two level of pressure. One pressure will ask the patient to give oxygen, and second pressure will remove the carbon dioxide from your lung.
Carbon dioxide.
So this is your BiPAP. Understood in your brain? Just note it down in your brain. Second thing, for okay.
Your voice is breaking, ma'am. Can't hear you.
Ma'am, I think it is a network problem from your
Can
side.
anyone tell me what is written besides the mask?
Hi all. Hello.
Hello.
Can we connect one group? Hello.
Maybe it is a problem from admin side.
Yeah. Can we create one group?
Sorry?
Can we create one group for
Yeah,
discussing about like disease condition, then today what they want.
yeah.
You have any clarification means you have to put the group. I want this topic.
Actually, today we are discussing about emphysema and COPD, and Madam elaborate very good technical point of view. So I think Madam is come back now.
Yes.
Who was
Carry
the
on.
person who asked for break? I would really want to know.
Sorry, ma'am.
Who was the person who asked for break? So whenever a person asks for break, my phone automatically got off. And like, अब तो break देना पड़ेगा बच्चों को. Did you took your break?
No, ma'am,
Yes, ma'am.
sitting and waiting for you.
No, मेरे लिए वो break था, ठीक है? अब मैं ये मत कहना कि मैम break नहीं मिला हमको.
Yes, ma'am. We need a 10-minute stretch break.
No?
Eat something or drink something.
Okay, I'm waiting for you for 5 minutes. Okay.
Recording in progress.
Go grab something for yourself, and then we will go for your break. Go take 2 minutes break, not more than this 2 minutes.
Okay.
Very short 2 minutes, because it's already 7:55. Okay, 2 minutes. I'm counting my imaginary watch.
We have also start stopwatch, ma'am.
Yes, your time starts now.
Ma'am, can you please put a group for just whoever is in the class, because the other from administration, we have 70 people.
I'm sorry, please send anyone. What are you saying? You're saying?
I'm saying, can you create a group for us, please?
I think you all are in a group, right?
Yeah, but there were 70 people, not just we, like whom we are seeing. in
It's
the
okay. I'll do one thing. If you want to, that group is, it doesn't matter. Doesn't matter if more people involved. It doesn't matter anything. It's good. We got more brains that are working together. So use that group only. So if I be in that group, okay, you're asking me to be in a group where everyone is there. Are you saying this?
You can stay, but we are not comfortable with whom we are not even new, right?
Actually, Rupa is trying to say that make a group only of the people who are taking the classes, like 8-10 people. That's what she's trying to say.
I will ask the administrative point of view, and then I will get back to you. Okay?
Okay.
Because things are not easy, as you see, working. But yeah, if you are, take break, just 5-minute break, or I will start.
Thank you.
I don't know. I saw Sasi when Shashikala was in the class. Shashikala is still in the class? No?
No.
Okay. So you have a son or a daughter?
No. Last year only I got married.
Oh, newly married. Cool. And someone was waving hands from your back. So I was like, who is this?
No. Nothing is there.
Don't say this. There is a ghost living with you. Just go and check your corners.
No, nothing is there. There is some cloth is
Yeah, might
moving
be some
over
cloth
there.
or something. Like someone is waving. Like, is that Ma'am Zam? Is that getting some some intuition or something. That is cool. Farhad?
Yeah. Is it a break?
No, it's not break. It's break just for everyone around us, except Shashikala and Farhad.
Oh, I was leaving, then I thought you were speaking, so I thought maybe you were teaching something. Okay, I'm back.
Farhad, you're serious? Like, you're just born serious, or you just changed yourself for this class?
Who, ma'am? Me?
Shashikala, thank you, Jai kar rahe hain, ma'am.
I'm basically chill person, ma'am. So I'm basically like comedy person. So I make two people laugh, and I'm also always smiling face.
Yeah, same with me. When I am with like my friends, they are doing MBBS. Okay, so when I talk to them, or just when we study together, something because they are with my same age group, so they study. So I'm like, okay, just part of group involve me. I don't know what they're studying like nerds, like everything they're reading. Like, who study like this way? I cannot study. For me, if I want to study, I want to be happy. I want to be very cheerful. I want to make laugh. And they're studying for straight 7-8 hours. I'm like, no, I cannot. I can only study for 2-3 hours max, not more than this. So when I hear like so many faces in the group also. So I feel like, oh, why are this investing their happiness for all of this? Happiness should never be invested.
Yes.
I like
Happiness and kind.
yes, happiness and kindness. Okay, I think we have to start because I have only half an hour left. Okay.
Yes, ma'am.
Okay, everyone back. Okay, no more breaks now.
Ma'am, after class, can I speak to you personally, please?
Yeah, very personally, you can speak to me. Okay, we will just what we will do. We will block everyone around us. Okay. Top scripts. Okay, don't worry, we will talk. Anyone else who wants to talk to me? Rupa, you okay?
Yes, ma'am.
If you're okay, then I'm okay. Cool. Okay, let's start with, okay, I really wanted to show you the one diagram of emphysema. Okay, can you see this big airways? Yes or no?
Yes, ma'am.
Can you appreciate the person who dissected this all and had made a very clear, can you see this bulla formation throughout the lungs? There's bulla formation. This is also called honeycomb-like structure of your lungs. Okay, let me show you the more clearer version. So you can have like, can you see this small honeycomb-like structures? See these structures in the lungs. So can you understand how your smoking is killing us? I asked you to study about Virchow triangle. Anyone have studied?
No.
No time.
I made you into my jal, and you just came into my jal. Okay, you should have studied. Anyone else who has studied about Virchow triangle, because this was important? Okay, if not, then it's okay. Go back home and read about Virchow triangle because it's important. Okay, so let's understand the thing that we have studied till now. We have studied about two diseases, chronic bronchitis, and second was what? Your emphysema. So we have discussed the problem associated with that. There is bronchoconstriction as well as the destruction of the airway. That's why the air is being collected in your lung, and the carbon dioxide, you cannot exhale carbon dioxide, and that's why your patient is becoming very lethargy. And there's so much of use of the energy in order to respiration. So the patient is becoming very thin. So you need to increase which kind of food you're going to give? Increase in
Protein rich
calorie,
diet.
increase in protein, okay? Increase calorie, increase protein. Okay. So do you know, when we talk about our lungs, okay, so lung is sitting on the diaphragm, yes or no?
Yes, ma'am.
Okay. Beneath the diaphragm, you have your stomach.
Yes, ma'am.
Yes,
Yes.
ma'am. Stomach and lung.
Yes.
Liver.
Yes. So this is your, if I'm making this as esophagus, so esophagus is piercing through your diaphragm and there's the stomach. So just imagine you ate a gobi ka paratha. Do you know what gobi? Everyone knows what gobi is. Cauliflower.
Cauliflower.
Cauliflower. Okay. So, or fish, or cauliflower, or dairy, or pulses, something like this. Egg, fish, gobi, onion, and beans, fermented food. So what will they do? They will increase the gas production of the airway. Okay. And when the stomach will get full, it's going to push the diaphragm, further pushing your lungs. Yes or no? And then there will be a volume will decrease. So air will not.
Pressure will increase.
Yes. So there will be further difficulty in breathing in of the patient. Yes or no? And this can in turn cause and difficulty in breathing. So you will ask patient to avoid, write it down. Gas forming food. Avoid gas forming food. 10 food I am asking you to write. 10 food you will go home and study and tell me. Fermented foods.
Yes.
Avoid fermented food.
Avoid gas.
Avoid gas forming food. The food which produces gas in your body. Your gobi, okay, your dairy products, paneer, doodh, dahi, butter, chach, fish, egg, mushroom, candies, chewing gums, pulses. Okay, so these are the food that you need to avoid if a patient comes with you with the complaint of COPD. Okay,
COPD.
Understood? Okay, apart from this, can you write 10 food at your own home? Go search and write 10 more foods. Okay, this is your homework. Next, diet should be increase in calorie, increase in protein, increase in fiber, increase in water. Okay, fiber does not produce gas. Okay. Second thing, up-to-date vaccinated. They need to up-to-date get vaccinated. Okay, with pneumococcal and influenza. Okay, vaccinate with influenza and pneumococcal. Okay.
Yes, ma'am.
Okay. Apart from this thing, can you also, okay, now the second problem is to remove carbon dioxide from your body. So in order to remove carbon dioxide, listen, the drugs will help in patient, but understand there is a permanent damage. Okay, so if you want to if you really want to help the patient, so you have to ask the patient to remove carbon dioxide from their lungs. So how will the patient will remove carbon dioxide from their lungs? So they will do by a technique called pursed lip breathing. Write it down. Pursed lip breathing.
First.
Yes. Pursed lip breathing. Pursed lip breathing. Okay. How many of you have ever celebrated their birthday? A good question I'm asking. How many of you have celebrated birthday?
Everyone.
Everyone have celebrated their birthday. Okay. How many of you ever have
Blow the balloon.
received rose? Anyone have
Sometime.
any? So everyone have received rose in their life.
Yes, ma'am.
So
Yes,
if
ma'am.
boys have ever gave rose, you must have come across flowers, rose, flower. How do you smell a rose or a flower or a beautiful perfume? Good. How do you smell? Anyone of you smell like
Deep in blue.
कोई ऐसे मुंह से सूंघते ऐसे?
No.
पक्का?
No.
पक्का? सबने breathing in loveness. Have you received rose loveness on my
Yes,
screen?
I have.
Okay, so how do you smell rose loveness? How you blow candle? I'm shy. I'm shy. Okay, it's okay. How do you smell a rose? Anyone? Just you keep your rose in front of your nose and you breathe in. Okay, so you breathe in. How do you blow candles on your birthday? How do you blow candles?
Exhale air.
Very good. We
Exhale
exhale air.
air by mouth.
Okay, so this is what you have to exactly do in your first lip breathing. You have to smell like a rose and blow like a candle. Smell like a rose, blow like a candle with a ratio of 2:4. So there will be less time in smelling a rose, like breathing in, and more time in breathing out with pursed lip breathing. This is called a pursed lip breathing. Okay. Understood?
The question आ सकता है.
बहुत ज्यादा. ये तो आपसे पूछेंगे. कोई आपसे बुला नहीं पूछने वाला, बस समझाने के लिए मैंने पढ़ाया आपको. Next, we have we have tackled the one problem, that is accumulated carbon dioxide in body. But now the second thing is to remove cough from to remove secretions from your lung. You have to do a technique called huff cough technique. Huff cough technique. So how does huff cough technique is like you exhale out and you cough. So like so you are exhaling out as well as you're coughing out. So what you are doing? You are yes. So while exhaling, your muscle contracts. Okay. So this will facilitate in removing the secretions from your lung, and you cough with and forceful expiration is a cough. So you're coughing. Okay. Okay. So this is called huff cough technique. Understood? Huff cough technique and first lip breathing. You have to do postural drainage, chest physiotherapy, postural drainage. Right, one very important thing, that before doing chest physiotherapy or postural drainage, you have to give bronchodilator to the patient. Okay, bronchodilator to the patient. Okay, understood? Now, right, COPD is done. Okay, so the drugs will be used for COPD will be your bronchodilators. Okay, and then I have to teach you about exporant and your mucolytic, which I will teach you later. So don't worry about exporant and mucolytic. So, but now let's about the third type of your, fourth type, bronchoatelectasis. We have studied about this term. What is bronchoatelectasis? Yes or no?
Yes.
Yes. So let's learn about broncholectasis. Okay. So we'll read about broncholectasis. Give me 1 second. Just give me. Okay. Okay. So bronchiectasis in which there is an enlarged bronchial Okay. What is bronchioles? Anyone can tell me what is bronchioles? Trachea, bronchi, and this is your bronchi, and these are your bronchioles. So listen one thing. Your emphysema affect your these part. Emphysema affect your these part. Your chronic bronchitis affect these part, and your bronchiectasis affect your bronchioles. So they basically affect your bronchioles. Okay. So there is enlarged bronchial tubes. So the bronchial tubes get enlarged. So bronchial tubes get enlarged and there is inflammation. Okay. Okay. Now understand there is no, if I teach you, there's no specific cause. This will cause like this. Okay. But there are so many other, this chronic bronchiectasis, it happened due to and secondary to a disease. For example, if a patient is having cystic fibrosis or pneumonia, then it can lead to the bronchiectasis. Understood? There is no specific cause of disease. It is caused due to and superimposed by some other diseases of the lungs. Okay. For example, pneumonia, cystic fibrosis. So when a patient is already having some kind of lung disease, and it can lead to the bronchiectasis. Okay. One thing very clear. Okay. So just imagine one thing. Just take an example of cystic fibrosis. Okay. I'll teach you later what cystic fibrosis, or just take an example of chronic bronchitis. So what happens in chronic bronchitis? There is an accumulation of sputum. Yes or no? Yes or no? There is accumulation of sputum in your airway. This is your airway. There is accumulation of sputum. So what is happening? These sputum will act as a breeding ground for your bacteria to grow. So when the bacteria will grow, they will call inflammation. Okay. So inflammation, more the inflammation, more the constriction of the airway. So it goes like this. Airway damage. Okay. Airway damage lead to inflammation. Just infection. Infection lead to airway damage. And when airway damage, it is called inflammation. And hence it goes round and round. Okay. Infection will lead to airway damage. Airway damage will lead to inflammation. And the cycle goes all around. Understood?
Okay.
Next. So understand this. This is the only enlarge of your bronchial tubes. It is caused due to any secondary diseases like cystic fibrosis, bronchiectasis, pneumonia. Okay. The sign and symptom will be similar to all chronic obstructive diseases that we have discussed. For example, dyspnea. Patient will come with a short dyspnea. Unintended weight loss. Okay. Cough with blood. Okay. Wheezing. Okay. One thing I want to make you understand one thing. Even we're talking about COPD or we are talking about your bronchiectasis, there is one phenomena which is called as clubbing of nails. Does anybody know what is nail clubbing? Clubbing of nails?
Change the shape of the nail.
You know what? Whenever our body have
Like
chronic hypoxia.
claw.
Yes. So what
That
happens?
is smooth.
Whenever our body have in chronic hypoxia, our distal blood vessels increase in their size and there is increased rush of blood to these parts because our body feels like, okay, we are in danger. So there's chronic hypoxia. So our body will think like, okay, there's shortage of oxygen in the body. So they dilate the blood vessel so that more blood can reach to the periphery. So when there is blood dilatation of the blood vessels, so the nail bed, talking about these nail bed, they get swollen. This is called nail clubbing and this pain. And so the angle will be like, okay, earlier the angle was like this. Now there is clubbing. So there will be an increased angle. So there will be increase of the angle. Just let me make a more beautiful diagram. Understand this is the nail. Okay. So this is nails. Okay. So how to make a good nails? I don't know how to make nails. Okay. Okay. Beautiful nails. Can you see these nails?
Okay, ma'am. So will this symptom will only be present in this disease?
Is this visible?
No, in heart condition too.
Chronic hypoxia.
No, any person who has like dyspnea, like they're not getting enough oxygen, they have this clubbing of fingers.
Okay, okay,
Is this
thank you.
visible to everyone?
Your voice is breaking, ma'am. You are stuck.
I think ma'am is okay, having network problem.
Yeah.
मैं खेलने के मूड में हैं? आज प्यारा लग रहा है जी पे आया तो है ना हाँ? हाँ? बैठ जा कोई मस्ती नहीं बैठ जा शाबाश शाबाश हाँ, चल बैठ बच्चे बैठ जा शाबाश बदतमीज शाबाश बैठ जा ओए पीछे 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 ओए पीछे पीछे ए वो पड़ गई चल
Is I'm back?
Yes, ma'am.
Yeah.
You all can see me, right?
Yes, ma'am.
Okay. So I was saying, whenever our body have chronic hypoxia, our body tend to dilate the blood vessels, and then there is so much of dilatation in the blood vessel, the size of our nail bed increases. Okay. And there is increase in the size. So this area gets swell up. Okay. So you can see swell up. There's one test that you can do. When you keep your fingers together, your middle fingers together, there should be a gap. Can you see gap? Everyone? Small gap. Do the test.
Yes,
Yes.
ma'am.
It means that we don't have, you can call it
Clubbing
yes,
nail.
we don't have nail clubbing. If we have nail clubbing, they would have gone together. So we couldn't see this gap. Can you see the small gap? Okay, this is the gap. Okay, understood? This is the classical sign of this. Can you see the screen, everyone? No? Okay,
No, ma'am.
write the second sign. Write the second sign. Cough with sputum. Okay, cough with sputum. Okay, whenever I'm talking about infection, you have to go for an sputum culture or sputum test. Sputum test or sputum culture. Okay, right? If the patient is having infection, it will have fever, chills, nausea, rigor. So all the signs and symptoms related to infection will be present in the patient. Okay. What are the signs associated with infection?
High fever.
High fever. Yes. Chills. Night sweat.
Wait.
Okay. Next.
WBC high.
Yes, WBC will be high. These will be sign. Okay. Okay. I said the cause is like secondary to any disease like cystic fibrosis, COPD, asthma, pneumonia. So, okay. What is chronic bronchitis? So till now we have studied about what is your chronic bronchitis. Then we have studied about emphysema. Then we have discussed about chronic bronchiolitis. So asthma. So did you understood about obstructive lung diseases? So these
Yes,
all
ma'am.
come under obstructive lung diseases. And on Monday, we are going to discuss about further part of the topic like restrictive lung diseases and all other some small topics. So mainly we have completed till now anatomy and physiology of respiration. The major respiratory drugs we have studied tomorrow. Okay, asthma, big topic that we have discussed. Asthma, epilepticus we have discussed. Now we have discussed about chronic bronchitis, chronic emphysema, and bronchiolitis. So these are topic we have discussed. Your homework is going to be read about atelectasis. Then you are going to study about Virchow triangle that I have taught you. And what is MDI? Meter drug inhalers. How to use them, how to operate them. This you are going to read and tell me. Okay, everyone understood? Is this clear?
Yes, ma'am.
Okay.
And
So now
clubbing finger, can you repeat me again?
Yes, so we have studied till now, and next on the Monday we are going to discuss a lot more than this. Okay, thank you so much. Have a good night. Have good
Okay,
sleep.
ma'am, I was
Yes.
saying that the MCQs that guy shared in the group, there were questions from MIT, ma'am. There were like
I
2-3 questions.
Yes.
So it was easy.
Hmm?
I said it was easy. Like
I know it was
simple.
easy. It was very easy. NCLEX is going to be easy. When you study about things, it's going to be easy. Did the questions that I have said yesterday in the group?
Yes,
No,
ma'am.
ma'am.
No. Who is this? No. I really want to. This.
I
Honestly
got it
speaking,
middle of the night, ma'am, so I couldn't. So it was the time phrase, so I just woke up and I saw the questions.
listen. Honestly speaking, when I was preparing for my NCLEX,